Hi everyone, I'm Dr. Amna Husain, board certified pediatrician, board certified lactation consultant, and mom. I'm mom to 2 girls and I'm expecting my 3rd, and we're answering your questions today about current world events and dealing with pregnancy. Hey everyone, so if you haven't seen our last video, we went through a Q&A after I announced our 3rd pregnancy, answering your questions on how the pregnancy is going, how it's been taking care of 2 girls, how this pregnancy has felt different. But there were a few specific questions that related to world events, and I thought that it would be a little bit more fair to those questions and answers if I kind of put those in a separate video. Some parents and mothers who are expecting may choose to not watch this, and that is my warning to them right now. We're not necessarily going to talk about anything graphic, but we are going to discuss some distressing content, and I think that's fair to say that that can upset a lot of people. And this is your chance to, if you choose to turn away, go ahead. I'd like to give that warning. I will say that I got a question on measles and the measles outbreak, and I thought that that was a very, very cognizant question of what's going on right now. So as you know, we've done videos in the past. I'll link the most recent one here about the measles outbreak in 2024 and how that's been affecting families, but families of children who are too young to be vaccinated, and also how that can affect pregnant women. So let's start off by talking about measles and how we check for measles titers in pregnancy. So after a pregnancy is established, you do a huge slew of lab testing, and some of that testing includes checking for measles titers or MMR titers, measles, mumps, and rubella titers. And the reason why that's important is because you're trying to find out if the mother's antibodies are present to those 3 viruses. And when it comes to pregnancy, and if you were to contract that, the antibodies do help to neutralize the virus and minimize symptoms. And that's a really, really big deal because these can be very, very dangerous for the baby, dangerous for the parent, but also very dangerous to baby, causing some severe congenital defects. And most of those are actually pretty irreversible. So we do check for MMR titers, and that's why it's a really big deal to get vaccinated when you're a child, because those vaccine titers are going to stick with you into adulthood. And if you choose to have a baby, it is going to help keep your pregnancy safer. I think that that does help provide some reassurance, of course, knowing that, I was vaccinated as a child. I do have immunity. That being said, you can be vaccinated as a child and your titers wane and you're not immune. And that can happen. And we do usually note that in the mom's chart too. And then you usually get vaccinated after pregnancy. Because it's a live vaccine, we don't vaccinate during pregnancy. It's a little bit stressful as a parent, obviously, but that does make a big difference in what your occupational hazards are, right? So my occupational hazard is very real. I work with children. Seeing a measles outbreak in children or seeing a measles case in children is possible. I luckily work outpatient rather than inpatient, so I do get to see a good mix of healthy and unwell children. I will say in residency, it was more prevalent for me to be aware of which rashes and viruses and sick children I was coming in contact with. For example, if there was ever a rash and we knew that someone was expecting, someone else would poke their head in first and make sure it didn't look like chickenpox, because varicella, again, if a pregnant mother contracts that, that can also cause irreversible defects with the baby. And it can be dangerous, obviously, to contract that as well during pregnancy. So we in peds are very well aware of some of those prenatal infections, and we do recognize the risks exist. We're very careful about contact, very careful about wearing a mask when appropriate, and that's a luxury we have living here. Not all healthcare workers do. Which brings me to my next set of questions, and a lot of these questions, I'll be really honest, relate to the current genocide that's going on in Gaza. And we've talked about this a lot through some YouTube shorts that have been posted on this channel. And obviously this is a healthcare catastrophe in a way that we've never seen before, with over 400 healthcare workers dead. You have women who are pregnant who are at severe risk of anemia even before this war broke out, that are that are really suffering in unspeakable ways. Stillbirths have gone up, preterm births have gone up. Neonates who are born to mothers are not surviving either due to dehydration, hypothermia, sepsis. There's so many things that we've talked about before on our shorts, but also on other social media channels. I think that you have to consider how learning and taking this all in affects you and how it feels to you. That's a personal luxury that we all have, but that's a luxury that you can, I believe, choose to take advantage of if you feel like hearing this news is adversely affecting you. A lot of people have asked me, how do I feel about this? Do I feel guilt? How do I kind of get past this? And I will 100% say that anytime I feel like, oh gosh, I'm so thirsty, or gosh, I'm so tired, or I just want to sit down, my thoughts do often go to women, especially in other underserved areas, Sudan, Haiti, Gaza that we've talked about, where they cannot get that regular prenatal care. That really actually pops into my mind more when I'm at my doctor's appointments. When I get the chance to get regular prenatal care, that's where it really actually pops into my head. And I don't think I feel guilt per se, but I do feel grateful. I'm thankful that I don't feel guilt. I just feel very grateful that I have been given that opportunity to be granted this luxury of healthcare where others have been stripped of it. Going back to what we said before, that if you ever feel like this is too much for you, and full disclosure, with my second pregnancy, there was a similar, not by any means as aggressive or as large or as horrifying, but an aggression that occurred in Gaza, and I was a little overwhelmed by the news, and I did feel like I was feeling palpitations and just feeling very not just heart racing, but feeling very down and uncomfortable and just overly anxious, seeing so many children suffering. And I don't know if that's my own nature or if that's the pediatrician in me or the mother in me, but I did have to kind of step away because I did feel like there was this perinatal anxiety that occurred when I was following world events and children were being impacted. I'd say a lot of it does also occur with seeing school shootings in this country, with how prevalent they are, and seeing so many children suffer and large mass casualty events. Again, I don't know if it's the mother in me or it's the pediatrician, but it does sometimes happen that I have to kind of step away and not follow that content. I felt like it was more prevalent in my second pregnancy than it was in this one. With this one, I did definitely have to take a step back, just generally for my own health, because I did have an asthma exacerbation. I was throwing up quite a bit from all the coughing, and posting or discussing what was going on in the world was not at the top of my mind with my current health. And that felt right to me at the time, because again, I have to take care of myself too. Evaluate yourself, take a step back when you need to. It's okay to do so. If it feels okay to you to continue talking about this without feeling like your mental health is being impacted, then keep doing so. If you need to take a step back for your own mental health, your emotional health, your physical health, then feel free to do that as well. I know this was a heavy topic. I think that it was important to address though. I hope this video was helpful for you all. I hope you're able to relate to it in some way. It's absolutely not easy talking on a public platform about these types of things, but I do feel like it does need to be talked about. I'm happy and honored that you feel that I'm the one to share on that. Certainly has not been easy to witness, but I can't even imagine going through it. So it's times like this that I'm grateful that I was afforded this opportunity to get prenatal care and to seek an alleviation of any symptoms that arise, because I know that other people in the world are not able to do so. And unfortunately, their pregnancies and their children thereafter suffer for that reason. I know it's a heavy topic. If you guys have any questions, please feel free to ask them, and I'll make sure to try to answer them when I can. Thank you so much. Have a good week. Bye.